Hi, my name is Mark Dermer. I'm a family physician in Ottawa, and I'm a passionate advocate for virtual care that is safe, effective, and patient-centered. For this installment of FM Pivot, I'm going to speak to you about the future prospects of virtual care in chronic disease management. I'll say at the outset that chronic disease management is the area of primary care where we have the greatest opportunity of benefit from virtual care. That is because whereas many other things that we do in the course of our day require patients to be with us in person or to use synchronous encounters via video or audio, in the case of chronic disease management, many of our encounters can be done through the exchange of written information in the form of secure messaging. We refer to that as asynchronous virtual care. So when we think about what we're doing with diabetes, hypertension, congestive heart failure, the most common chronic diseases that we manage, we are often using quantitative data, blood sugar levels, the patient's weight today, the blood pressure reading, and responding to those by either affirming the present treatment plan or proposing modifications and titration to medication or non-medication treatments. That can be done very easily in the exchange of written messaging, and it can be very effective in the management of patients. Furthermore, a lot of innovation is taking place right now in trying to develop ways for patients to self-examine at home. Think of techniques to verify foot sensation in diabetics, or the ability to auscultate lungs in a patient with congestive heart failure. And as those become affordable and available, patients will be able to gather even more of the data, further broadening the scope of what we can safely attend to via virtual care. Now, all is not perfect with virtual care or with anything else. There are two problems, and these problems are common to all areas of virtual care. The first thing we need to keep our eye out for is the appropriateness of virtual care for any given encounter. If we are in a discussion with a patient and we realize we need to perform an examination maneuver that can only be done in person, we need to arrange for them to come in to do that. And if something in our communication with one another indicates that there is misunderstanding or perhaps a little bit of friction, human beings do best when they are in the same room with one another. That's where it's best to build and rebuild trust in between two people, and that needs to be called upon when appropriate. Still, overall, the future for chronic disease management using virtual care is very bright and promising, and I urge you to try to integrate it into your practices. My name is Mark Dermer for FM Pivot.